Now, this is a very interesting report where we can see that this T3 is 0.556. It means it is less, it is reduced. T4, it is 4.86. It is also very much less compared to the normal range. And interestingly, the TSH is also less. It has to be at least 0.27, but here it is around 2. So what does this indicate? Most of the time, what we label this as hypothyroidism because the T3 hormone and T4 hormone, which are called thyroxine hormones, these are less. And we label it as hyperthyroidism if these values are high. So in our case, both T3 and T4, they are very much less. It means that this is hypothyroidism, where there is decreased synthesis or production or release of these hormones into the blood. So actually, here the fault is not of a thyroid gland, because if the thyroid gland would have been at a problematic level, the TSH would have definitely increased. So TSH is the message from the brain that tells the thyroid gland, to increase the production of this thyroid gland. But in this case, the thyroid gland is not a problem. In this case, brain is not working properly. In short, the pituitary gland is not producing enough TSH. So if the pituitary gland is not producing enough amount of TSH, this message will not be sent to the thyroid gland, and the thyroid gland will not synthesize the T3 and T4 hormones. So what we label it as is, we call it as central hypothyroidism. So we label this as central hypothyroidism. And why we need to know this? Because the brain is not giving me messages. That is the reason why T3 and T4, they are not synthesized. So the patient will have signs of hypothyroidism, which will be weight gain, period irregularities, weakness, tiredness, laziness, emotional lability. And here, when we start treating, what is the usual dose of thyroxine that we start? It's simply approximately weight into either of the weight or up to 1.5 kg per 1.5 unit or microgram per kg. So if patient's weight is around 50 kg, then we can start 50 to up to 50 into 1.5, that is around 75 microgram. So if the patient weight is around 100, we can simply start with weight equal to weight mcg, that is 100 to 1.5 of the weight, that is 150 microgram of thyroxine medicine. And surprisingly, in this central hypothyroidism, we usually don't chase TSH. We simply chase T3 and T4. So we have to continue the dosage. We have to modify the dosage as per T3 and T4 and not as per TSH, because most of the time we chase TSH values. So as soon as TSH is normalized, we continue the same dosage. But in this case, as the pituitary gland is not working properly, the target of our therapy will be to normalize T3 and normalize T4. On whatever dose this T3 and T4 are normalized, we'll simply continue the same dose irrespective of this TSH. Thank you.